Can a dog be quarantined for rabies? Have you ever wondered what happens if a dog is exposed to rabies? It's a serious concern for pet owners and public health. Let's break down the facts about dog quarantine for rabies. Yes, a dog can be quarantined for rabies if there is a potential exposure to the virus. This usually occurs after an incident where the dog may have bitten someone or had saliva contact with a person or another animal. Quarantine is a public health measure to monitor the dog for any signs of rabies infection. The typical quarantine period is 10 days. This time frame is based on the fact that if a dog is infected and able to transmit rabies, symptoms usually appear within this period. During this time, the dog must be observed closely. A licensed veterinarian or a designated health authority supervises this observation. In some cases, home quarantine may be allowed, but it often requires approval from local health officials. If the dog is unvaccinated or if its vaccination status is unknown, the need for quarantine becomes even more important. Rabies is almost always fatal once symptoms show, so monitoring is essential. For dogs that have been vaccinated against rabies, the quarantine protocols may vary. However, observation is still necessary to ensure the dog remains healthy and free from the virus. If a dog is suspected to be rabid or shows symptoms of rabies, euthanasia and laboratory testing of brain tissue may be recommended for a definitive diagnosis. If the owner refuses euthanasia, extended quarantine periods of several months may be imposed. However, this is less common and comes with strict conditions. Rabies vaccination plays a key role in preventing the disease. Keeping your dog up to date on rabies vaccines according to local vaccination schedules can significantly reduce the risk of infection and the need for quarantine after potential exposure. In summary, quarantine for rabies in dogs is a legally required and medically necessary practice following potential exposure. It involves a 10-day observation period under veterinary supervision to monitor for signs of infection. Vaccination is essential in preventing rabies and minimizing the impact of potential exposures.